South Africa's private healthcare industry is in crisis. Fraudulent medical aid claims have seen a huge spike in members' premiums annually, which makes private healthcare simply unaffordable for most.
Well, there's a crisis in medical aid in that the premiums that you pay and your contributions that you pay are becoming unsustainable. Fraud, waste and abuse contributes towards that.
According to medical aids, health providers fleece members' funds of between 9 and 19 billion rands a year. In this program, we uncover a syndicate of bogus doctors that have siphoned off millions of rand from medical schemes.
Chest is tight and my nose is blocked.
Most of these claims are small amounts, but if you start calculating all of these providers together and you look at the big picture, it could be in the millions. Easy, 5, 6, 7 million rand, even 10, 20 million rand.
We have established that the mastermind of the syndicate is a convicted doctor, William Mogaila, previously exposed on special assignment for recruiting fake doctors who pose as him.
She said to me, "I'm Dr. Mogaila." She said it, that I'm Dr. Mogaila, and it was so weird. I asked them if they take medical aid, and she said yes, they do take medical aid.
Since our last investigation, his criminal enterprise has grown. His latest scam now comprises of a series of dodgy clinics in Gauteng and other provinces, where bogus doctors consult patients and defraud medical aids. Lister Medical Centre in Johannesburg's inner city has, for many years, been seen as a centre of excellence for the medical profession. Doctors here have taken a Hippocratic oath to treat the sick to the best of their ability. Therefore, fraud is something that one would not expect doctors to commit.
This is a very serious crime because a professional doctor is taken as somebody who contributes to the community very positively, especially when it comes to our health, which is the priority in our lives. So we take this in a very, very serious view.
More than a year has passed since police raided Lister Building, arresting Mogaila and his associates. Mogaila didn't do jail time, but got a suspended sentence instead. So we sent our investigator to find out if he had desisted from his criminal behavior. Surprisingly, he finds this woman, clearly not Mogaila. She issues him with a sick note and proposes he gets an injection to treat an infection.
No, I'm not coughing. Just the voice that went the throat.
Say ah. Again.
Ah.
Can you get an injection so that you will start?
Okay.
But it's 300 rand.
For the injection.
The injection is very, very strong.
210 extra.
I told her that no, I will come back for that, and I asked her why should I get an injection. She said no, it will make fever go away as quick as possible, and I'll get back to normal and be able to go to work.
He returned with a probe card used by medical fraud investigators to track fraudulent medical aid claims.
Medical aid night.
Despite not having an ID document to verify if his details corresponded to the medical aid card, she allows our undercover investigator to fill in forms to put through the claim.
claimed she had tonsils and some infections. And she also recommended that I should get an injection. And that's the only thing that she recommended. She said, no, there's a chemist down and a pharmacy down there, and I should go get the injection. And yeah, I went to get it.
Medical aid fraud costs healthcare funders billions of rands annually. It has a direct impact on patients' access to treatment. Without the necessary funds, an urgent medical procedure wouldn't be possible.
A medical scheme operates on a principle of cross-subsidization, where the healthy subsidize the sick. Now, the more expensive the sick become, the more healthy people you need. And therefore, it becomes way more expensive when a lot of wasteful and abusive claiming occurs, because the funds are not being channeled to where they need to be in terms of healthcare.
We asked a forensic investigator to track the medical aid claim submitted by Dr. Mokhaile's surgery.
A claim was submitted for R2.50 for an injection, and then another claim was submitted for approximately R3 for medication that's been submitted. The claim was submitted by the pharmacy and not by the actual provider.
It's alleged that Dr. Mokhaile and the pharmacy at Lister Building are involved in the scam. Collusion between healthcare providers has dire consequences for medical aids.
The moment there's collusion between the members and the providers, that is fraud, and that is intentional. And this was a very well thought out plan, so it's definitely syndicated, and you often find providers can collude with each other, or members can collude with each other, or providers and members can collude. And especially in a small environment where all the medical scheme members are employees of a specific company, word can spread quickly, like wildfire.
The claimed amounts appear to be small, but investigators say this is often done so as not to raise suspicion.
A small amount was submitted for R2.50 and R3. A month later, a claim was submitted under Dr. William Mokhaile's name for consultation with seeing a new established patient. Interesting thing is that they saw a Congolese lady working in the practice who tended to the patient at that given moment, who pretended to be William Mokhaile. This is the modus operandi of these providers to do this. By submitting first small amounts, staying underneath the radar to see if anything is going to happen, and if nothing happens within a month or two, then they will submit the full claim.
In Duduza, a few kilometers outside Johannesburg, we came across another of Mokhaile's surgeries.
When I went there in Duduza looking for the practice, it took me time to find it. Reason being, where it's situated, you know, it's unbelievable. It's in some location, some guy's house. It's a back room. It's so dodgy, I don't want to lie to you. Even the advertisement, the board that they use to advertise, it's handwritten. You would think that it's written by a child or something. You know, I don't think a normal person would want to go consult in that practice.
Here, our investigator has asked to see the doctor.
This you're supposed to take it, all of them 10 straight.
Okay.
But you'll take it in separately twice. So once you get or more, or if you already eat something, just take 5 tablets now. And before you go to bed, maybe at 10, you take the remaining.
Okay.
But normally you're supposed to take it straight. And this one, you have to take it 1 tablet twice a day until it gets finished.
We got a tip-off in Heidelberg. I went there, and the practice is also situated in a house. And what's strange is that it's across the road. It's Department of Safety. You know, I went in there and I saw the doctor, and she diagnosed me and prescribed medication for me. She said to me, "I'm Dr. Mokhaile." She said it, that I'm Dr. Mokhaile, and it was so weird.
Do you take medical aid for future?
Yeah, I take medical.
Okay. Thank you very much, doctor. Thank you. Thank you. I thought I didn't get your name. You are Doctor. Oh, okay. Thank you, doctor.
In Diepsloot, we consulted with one of Mokhaile's associates. Although Mr. Ngubani is not a doctor, but a nurse, he's been diagnosing patients and putting fraudulent claims through to the medical aid.
Yeah, my chest is tight and my nose is blocked in the evening. Then my nose is blocked. And sometimes I do have a mild headache.
Ngubani was arrested for posing as a registered doctor. He and Dr. Pasha are accused of allegedly conspiring to defraud medical aids. Meanwhile, in Boksburg, authorities recently arrested Picho Kalala, a foreign national with links to the syndicate.
There was an information that was not sent to us as the police, but it was sent to the health professions of South Africa, and they did an operation on that information, where they were informed that there's a suspected doctor who is operating illegal in Boksburg. They went to the premises where the doctor was operating, and on their arrival they found the foreign national who confirmed to them that he didn't have a qualification. So now they called our police guys who went there at the scene to arrest the guy.
According to forensic investigators, Lister Building is the nerve center from which the syndicate runs its operations.
That's the headquarters. From there, we have identified numerous other practices, small practices around Johannesburg that links to William Mokhaile, who is actually, when you go and visit them, you will receive a script saying Dr. William Mokhaile. So far, we've identified as far as in the northwest as potential links to the William Mokhaile or to the Lister House, as well as possible links in Mpumalanga that links to the Lister House. So it started spreading interprovincial. It's not only in the Gauteng area, but it's now looking at other areas as well.
The rise of dodgy medical practices across Gauteng is a growing phenomenon. Government legislation to clean up the health sector is ineffective.
As we work in conjunction with the Office of Health Standards Compliance and the Health Ombudsperson, we will create health standards to be met in terms of what a facility should be like. We hope going forward, facilities would be registered. So when you see a practice, is it registered? Has it been inspected? Has it been approved to meet the minimum standard to provide care to people? Once we get to those issues, we'll begin to ensure that you don't have an undignified space being declared Kwato Hotel. And when you look at it, it's a shabby place, poor sanitation, it wouldn't pass a health inspectorate.
Police have established that Kalala entered the country illegally to work as a doctor.
The man is illegal in the country. He's from Congo. He used Zambia, and then from Zambia he took Zimbabwe and Bait Bridge to South Africa. He walked to the country.
Do you think he jumped the border?
Yes, it has been established he's illegal in the country, although we are at this point we're not really sure how he came to the country.
We made a number of calls to Dr. Mokhaile's medical surgeries to get his response to our investigation.
Welcome to voicemail. Why don't you leave a voice or fax message after the tone?
But we were unsuccessful. When we eventually got through, a man that sounded exactly like the bogus doctor at his Deduza surgery claimed to be the elusive Mogaila.
Yes, hello?
Hello, can I speak to Dr. Mogaila, please?
Yes,
How's it, Dr. Mogaila?
I'm okay, and you?
I'm okay. Yeah, you're speaking to Sipho. I just want to ask you, based on my investigation here, I see you've got a couple of surgeries in Postberg, Duduza, Heidelberg, and there are people who are working for you there. Where did you find them?
At the Duduza, yes. But what's the problem with the surgeon?
Okay. Are you sure you are Dr. Mogaila?
Yes.
I had a conversation with Dr. Mogaila before, so I don't think you are Dr. Mogaila.
Why?
Because of your accent, sir.
Why you call me for this problem?
Are you Dr. Mogaila?
Why you call me? You talk with me, we don't trust me. But you call me why?
Yeah, because Dr. Mogaila is a South African and your accent is not of a South African.
Police are investigating links to the syndicate in the Congo. Kalala appeared in the Boksburg Magistrates Court and was denied bail.
He is being charged with impersonating a professional doctor, of which he has no qualifications to do so. Dispensing medicine as well, because you need to be registered to do that.
Kalala also made a number of fraudulent claims to the medical aid.
But you think front of the change.
According to healthcare funders, medical aid fraud is one of the leading crimes in South Africa. It's estimated that fraud costs the industry up to a whopping 19 billion rands per annum. Money that could go towards providing better healthcare for all.
There's 8.8 million registered beneficiaries of private healthcare, which is under 20% of the population. The rest of the population relies on state resources and state healthcare facilities, and this has been highlighted by our Minister of Health on numerous occasions. The private healthcare sector is 124 billion rand, and healthcare in South Africa is 8% of GDP. It is really, the cost of healthcare is huge.
At this call centre, staff offer advice to members and scrutinise claims for potential fraud. MedScheme's Paul Midland says medical aid fraud is a difficult crime to detect, monitor and prevent.
What we've done now on our side is, because of the use of big data, we actually have predictive analytics systems that can actually compare that claim to all the other claims and look at the bigger picture in terms of claiming behaviour, and that should flag it as irregular. And then you can have the investigations where you can go and you can actually go to on-site and view, did that pharmacy have stock to dispense? Does that doctor have that equipment to be able to have rendered that service? So when you put all those elements together, you can manage and control fraud.
Police have made a few arrests in Boksburg and Diepsloot, but have been unable to put an end to the syndicate's criminal enterprise. With their headquarters at Lister Buildings still up and running, it is from here where other illegal medical practices in Heidelberg and Deduza, which are still operating, receive their orders.
We have established that these foreign nationals who are practicing at the surgery has been recruited by registered doctors who are still under investigation. At this point, we are really not sure if they are recruited while they are still in Congo or while they are illegal in the country. The investigation is continuing on our side and also on the side of the Health Professions National Council.
Medical aids have blacklisted the syndicate. in an attempt to put them out of business.
Some of the providers have been arrested, so their claiming have been stopped. Some of the providers have been placed on hold, meaning that they are not being paid at all. We're busy disrupting the whole network in a certain way, directly and indirectly to the main character, who is William Mogaila. By disrupting the actual supply chain of cash flow, you're also hurting the person financially.
The Medicines Control Council in Pretoria must ensure that all dispensed medication is registered and does not pose a health risk to the public. We asked them to verify the medicine dispensed from Mogaila's surgeries.
Once you start now dispensing that medication, the details of the doctor should appear on the packaging. So now I've dispensed. But now what's important again, now we are taking the medication out of its original container, which was validated for that shelf life. Secondly, whatever the doctor dispenses, there must be a trail of purchase to show that now this doctor has purchased this medication from this particular wholesaler or this particular supplier.
Despite the mounting evidence of his criminal intent, it appears that Mogaila is untouchable. In September 2014, he and his then partner, Paul Gabanonyo, were arrested for a number of crimes. When the matter went to trial, the pair pleaded guilty, paid a fine, and received a suspended sentence.
They've accepted their guilty plea, and those two accused have been sentenced, found guilty and sentenced. Then that is the end of the road of that matter. The state can't recharge them at a later stage. Obviously, if they do commit another offence with similar circumstances but a completely different set of facts, then they can recharge them, but not on the facts that they pleaded guilty. Those matters are finalised.
Dr. Mogaila was also charged by the HPCSA. But despite being criminally charged, the organisation that is meant to ensure that doctors do not commit fraud has allowed him to continue practising.
Was recently finalised in April, where he was then also found to have committed misconduct and sentenced for 5 years suspension. However, the 5 years suspension was suspended for 3 years, so wholly suspended for 3 years. So on a condition that he is not to be found to have committed the same offence again.
Doctors are meant to be respected members of society, but as for Dr. Mogaila, he appears not to realise the seriousness of his crimes. According to him, he has done nothing wrong.
After all the media noise and everything, they know me. Minister Mtale knows about me, how I've helped doctors, our patients here for more than 15 years. They know about me. Here in Gauteng, they know. Mr. Hope Up, you know, he knows about me. He knows me.
And the minister...
The previous MEC of Health, Hope Up, he knows me personally. You understand? Most of them, they know about me.
Okay, so you're a reputable doctor?
No, very good. My standing is very high.